All right, next up in the conversation, we're going to highlight the use of Tandem Gait and BESS testing for concussion management. A wonderful presentation by Jaclyn Morrissette, who gave this talk at ATSNJ 2021. Jaclyn is an assistant professor and the program director for the Athletic Training and Sports Medicine program at William Paterson University in New Jersey. Jaclyn, thank you for your time, and I want to get right into some of your main points because you really honed in on the concentration and coordination aspect of concussion care. And first, I want to talk about, you mentioned the importance of understanding the difference between cerebral and cerebellar system assessment. Can you get into that a little bit?
Yes, of course. Thank you again for having me on the podcast. So the big thing, and I touched a little bit more on it because it is more involved in both topics I talked about with BESS testing and the Tandem Gait, but cerebellar testing is looking at your balance. And it's not just balance from I can stand on one foot or I can stand on an unstable surface. It really has to do with how we move and how our body maintains balance as we move. And so proprioception is another term people use, kinesthesia is another term people use, and it's really how the brain functions, how we get visual input, how that visual input goes to our brain, tells our joints how to position themselves, and then how we maintain balance as we do that. And so if we're, again, I use the example, if you're walking and you are looking at your cell phone and you miss a step or you trip over something, it's because you're not getting that good visual input to your eyes because your brain can't process and make all the connections. So we trip, we fall, again, joint position, balance are all off. So that's the big part with the cerebellar. With the cerebral, it's the cognition. So it's what else can you be doing while you're moving to maintain posture and balance? So if you're walking down the street or having a casual conversation with a friend or a person, or maybe you're in a running group or a bike club and you communicate with each other, you're now doing a cerebral task with a cerebellar task. You're having conversations, you're thinking about some things, and then you're doing another task. And so when there is a disruption in that, potentially caused by a concussion or any type of head trauma, it can now cause there to be a miscommunication between those systems, maybe with each other, maybe with each parts of what their respective functions are. And so with that, we can now have a lot of issues when it comes to, not only can our patients have issues thinking in the classroom, but their movement patterns and how it affects them post-concussion.
And that's why you spoke to the importance of really noting postural swaying and gait assessment post-concussion.
Yes.
That's what you're looking for. So dive into that.
Yes.
What are you looking for with that? Why is that important to really keep an eye on?
So one thing to keep in mind is that, most of the activities that our athletes doing are in multi-planes. They're going to be moving in lots of different directions and very quickly. And so if there is any disruption in their regular sagittal plane postural sway, it's going to translate into other planes of motion that our patients are going to be moving in. So if you're doing, it's really hard to see postural sway in a dynamic function with BESS testing because you're standing very static, which is why I'm a bigger advocate for the Tandem Gait, or at least in addition to BESS testing, because when you're having them walk in that sagittal plane and you're making them do it on that line, they have to be balanced while they're moving dynamically. Again, I mentioned this in my talk, that is not exactly the most sport-specific activity, but it's a lot more movement-specific than, say, closing your eyes and standing on a piece of foam. So with that, watching any type of abnormalities during that task can really give or indicate that there are still some sort of miscommunication between the brain and how your body needs to move efficiently and effectively without injuring yourself further. So it's really important to identify even frontal plane movements, or even if someone's moving slower. So I don't know if you remember, I spoke about the differences between the SCAT3 and the SCAT5, and in the SCAT3 there was a time restriction, but they removed that in SCAT5 because 75% of the patients that they viewed, I think they were mostly high school athletes, failed the test. So it's a good use of testing before and after with timing, but it's not good as your standardized number. It's hard to pick a standardized number for that.
And when you were talking about the Tandem Gait test, you indicated it was a 3-meter length, heel to toe steps, walking down and back as a way to get an assessment on that. And then going back to what you mentioned earlier about the fact that everything we do is dual task, you called it, walking and talking, et cetera. So you can build that into that Tandem Gait exercise, but also as further evaluation, with those, especially with those who are maybe not able to communicate their symptoms, and whether it's hidden or just they can't verbalize what they're feeling?
Mm-hmm.
Why is it important that an athletic trainer incorporates dual task activities? What are dual task activities, for example, that they could be doing in their assessment, but also in the rehab return to play?
Very good question. So again, doing any type of dual task activity, we do multi-dual task activities probably every day, like I said, walking, running, thinking about what our patients do for their sport specific activities. So, it's really, it's pretty critical for us to incorporate that even in an evaluation. With an evaluation, if a patient seems that they are well enough to do a dual task, what I mean by that is you've assessed their balance, it seems to be okay, they're doing the tandem gait, you're really not convinced that they're moving really well, you can add a word recall, months of the year backwards. Like I mentioned, I'm not a big fan of the serial 7, but some people like it. I mean, I get to like 93 and I'm like, I don't care anymore. So, finding something that makes them think more, to then again assess, are they having any postural difficulties? And then, that can give you more indicator from an evaluation perspective. I haven't seen a lot of people use it for evaluation because usually it's tough to even get to usually you see them balance on one foot and you're like, forget it, with their eyes open, and doing the tandem gait at that point is really not that critical. But as a post-concussion or even as a rehab tool, let's say you're like, I don't have the time to gait test everybody. Well, you can still use this as a rehab tool. And, if they get really well at balancing, then they get really well at the tandem gait, and then you start to throw into some words to make them start dual task. And then I've even had people take a few steps, kick a soccer ball, take a few more steps, head the soccer ball, doing something sport specific, toss them a ball too, because now it's requiring them to stop, get in either like a position where they stay in that or they're balancing, and now they're doing something sport specific because they need to make that decision on how to catch that ball, how to head the ball, how to kick it. And so you can really tailor your dual task to whatever you want. I didn't really mention that much I had a lot to say in a little bit of time, but that's definitely something how you can make it so much more sport specific than just throwing the words. The words might be like your low level, and then you start increasing difficulty to get more. And again, you don't even have to limit to just the 3 meters. You can use a runway, you can use, a field and do cutting and just, create more sport specific scenarios and situations. So that way, that they are ready to go back out and they're not going to injure themselves further.
Jaclyn, these are great tips. Concussion world is ever changing and it's growing. And I think athletic trainers do a disservice to themselves and their patients if they don't keep up with the latest trends. And, we don't just do what we've always done in that world. That's more important than anything. So thank you for having these conversations and talking about these things, because this is way different than what I learned in school. And this is happening with a lot of other cases too. So we have to be sharp with this. And I'm glad you brought it to the attention. We can all dive into it deeper and have a better understanding of it. So thank you.
Yes, thank you. Thank you for having me again.
You're welcome. Have a good day.
Thanks, you too.